Alright, imagine this.
Your organs are like a city, and blood flow is the electricity powering everything. Now, shock is basically a power outage. When tissues don't get enough oxygen and nutrients, cells start dying. If this keeps going, organs fail. So the USMLE definition of shock is simple. Shock equals inadequate tissue perfusion leading to cellular hypoxia. Now the exam loves shock, but here's the trick.
Instead of memorizing random facts, think of 4 main categories.
1. Hypovolemic shock. 2. Cardiogenic shock. 3. Distributive shock.
4. Obstructive shock. If you understand these 4, you basically own the topic. Let's go through them one by one. 1. Hypovolemic shock. First up, hypovolemic shock. This one is the easiest. It simply means there isn't enough blood volume in the system. Imagine trying to run a water pump when the tank is empty. It just can't circulate anything. Common causes include severe bleeding, trauma, dehydration, burns, vomiting or diarrhea. Now here's the physiology the USMLE loves. Because volume is low, preload decreases, cardiac output decreases. The body tries to compensate by activating the sympathetic nervous system. So you get tachycardia, vasoconstriction, cool clammy skin, classic presentation, low blood pressure, fast heart rate, cold extremities, high yield hemodynamics, preload down arrow, cardiac output decreased, systemic vascular resistance increased. Treatment concept: give fluids, because the main problem is loss of volume. 2. Cardiogenic shock. Next, cardiogenic shock. Here the volume is fine, but the pump is broken. The heart simply cannot push blood forward. The most common cause tested on exams? Massive myocardial infarction. Other causes include severe heart failure, arrhythmias, cardiomyopathy. Now think logically. If the heart can't pump, blood backs up into the lungs and veins. So the key finding becomes pulmonary congestion. Symptoms include hypotension, shortness of breath, pulmonary edema, elevated jugular venous pressure. Here's the hemodynamic pattern the USMLE loves. Preload up arrow. Cardiac output decreased. Systemic vascular resistance increased. Notice something interesting. Preload increases because blood is backing up into the heart. Treatment concept: instead of fluids, we often use inotropes, revascularization. Treat the underlying cardiac issue. 3. Distributive shock. Now things get more interesting. Distributive shock happens when blood vessels become too dilated. The blood is there, but it's not reaching tissues effectively. Think of it like water spreading across a huge field instead of going through pipes. The 3 big causes are septic shock, anaphylactic shock, neurogenic shock. Let's break them down. Septic shock. This is the most common shock in hospitals. It usually comes from bacterial infection. Gram-negative bacteria release endotoxins, which trigger massive immune activation. This causes release of cytokines like TNF-alpha, IL-1, nitric oxide. Nitric oxide causes vasodilation. So early septic shock has a classic finding: warm skin. That's why it's sometimes called warm shock. Hemodynamics. Preload down arrow. Cardiac output increased early. Systemic vascular resistance decreased. Treatment includes IV fluids, broad-spectrum antibiotics, vasopressors if needed. Anaphylactic shock. This is a severe allergic reaction. It's a type 1 hypersensitivity reaction mediated by IgE antibodies. Mast cells release histamine, leukotrienes, prostaglandins. This causes vasodilation, increased vascular permeability, bronchoconstriction, classic symptoms, hypotension, wheezing, hives, airway swelling. Treatment is epinephrine. This is extremely high yield for exams. Neurogenic shock. This happens after spinal cord injury. Normally, the sympathetic nervous system maintains vascular tone, but if spinal cord pathways are disrupted, the body loses sympathetic control. So instead of tachycardia and vasoconstriction, you see something unique. Hypotension with bradycardia. That's the key exam clue. Hemodynamics. Preload down arrow. Cardiac output decreased. Systemic vascular resistance decreased. 4. Obstructive shock. The last category is obstructive shock. Here, the heart itself may be normal, but something is blocking blood flow. 3 classic causes tested on exams. Pulmonary embolism, cardiac tamponade, tension pneumothorax. Let's go through them. Pulmonary embolism. A large clot blocks blood flow through the lungs. This increases right ventricular pressure and reduces blood returning to the left heart. Result: low cardiac output. Symptoms include sudden shortness of breath, chest pain, hypotension, cardiac tamponade. This occurs when fluid accumulates in the pericardial sac. The heart gets compressed and cannot fill properly. Classic board finding: Beck's triad, hypotension, jugular venous distension, muffled heart sounds, tension pneumothorax. This happens when air accumulates in the pleural space and compresses the heart and great vessels. Key findings: severe respiratory distress, hypotension, tracheal deviation. Treatment is immediate needle decompression. Quick USMLE summary. Here's a quick summary you should memorize. Hypovolemic shock. Problem: low volume. Cardiogenic shock. Problem: pump failure. Distributive shock. Problem: vessel dilation. Obstructive shock. Problem: blocked circulation. If you understand those 4 mechanisms, you can answer almost any USMLE question on shock. And that's shock made simple. If you're studying for USMLE, Step 1, mastering concepts like this makes physiology and pathology questions much easier. If this helped you understand shock, save the video for revision and share it with a friend studying medicine. And in the next video, we'll break down another high-yield topic for the boards. See you there.